OT. This assignment is for you. Students who were BS students, undergraduate, and are transitioning, you can turn your ears off for a few minutes. So this is for post-bac students who already had an undergraduate degree, because you have to do an additional graduate level assignment in courses over the first year of the curriculum. Okay, so you're going to be assigned to a working group of 3 or 4 students. I reshuffled some of the lab groups, and I'll put that up in a second. This document and the group assignments are already posted on Angel, so you can access them. You're going to be doing a literature review assignment. The objective is that you continue to develop skills that you established in undergraduate for searching the literature, for doing a database search. So within your group, you're going to have to do a database search and synthesize that information and put together a PowerPoint or some type of oral presentation format for which you will write a script. Right now, this assignment is going to be due the last day of class, so July 7th, and Roger and I are still deciding depending on the schedule. In the past, we haven't had you actually present. That's the reason we have you write out your script word for word. We've just posted them and made them available as resources to the class, but we're still thinking about how you'll present the outcome of this assignment. But so know it's due the last day of class. So you're assigned to a research group. Just like with lab, it's a good idea to get together with your group and start to formulate your norms, decide how you're going to approach the assignment. One of the things that we really recommend is that you schedule meeting time throughout the rest of the course so that you can work together to synthesize the information that you get about the topic. If you sort of divide and conquer, split this up into pieces, usually we can tell that it's been broken into chunks and just chunked together rather than a cohesive synthesis of the material that everybody in the group brings together and works on in collaboration. So you think about setting up meeting times as a group. So like I said, you're going to have to identify a question that's relevant to occupational therapy within neuroscience. And we have some suggested topics. If you would like to investigate something that's not on this list, that's fine. Just talk with Roger and I to run it past us so that we can give you the okay. But in the past, some topics students have looked at, spasticity management, so different medications, Botox, how do those substances impact on the neuroscience of the brain, and then the functional implications for our clients in OT. Constraint-induced movement treatment, that's where clinically the therapist will restrain or for a certain period of time restrict the movement of a limb that's not impaired, and that way the limb that has been affected from a CBA, that client's sort of forced to use that limb in functional activities. And so you could look into how does that forced use of the affected side and the constrained use of the unaffected side, what happens neurologically, what's going on in the brain when we do that. Electroconvulsive therapy, ECT, a treatment that's used still in mental health for clients who have schizophrenia, so you could investigate something like that, or clients who have very severe depression. If you're interested in mental health, you could look at something like that. So we have some ideas here to get you started. Within your group, you'll have to pose a question within a topic. So like I said, you'll then search the literature, find evidence to respond to your question, and you're going to have to synthesize. So we don't want a summary of each article that you find separately. We want you to combine the information that you find so that you can construct an argument, respond to the question that you posed at the start. And so then we've given you a suggested outline for the slide presentation. You have an introduction to the topic, what's your question, the relevance to OT, have an analysis of the articles, and synthesizing how do the articles allow you to respond to the question, and then a conclusion. We really want to see that a presentation has a clear beginning, a clear synthesis, and a clear end conclusion. Okay. So along with the slides then, you'll need to do a narrative script. And you can do that in a couple different ways. Within PowerPoint, if you've used the speaker note function, you could do that. Or you could do a separate Word document and slide by slide tell us the narrative that you would have for that slide. That's the description of the assignment. And then the groups, just quickly, scan to see, but again, this is posted on Angel, so you can find this and then start to get together with the people in your working group. So these are the groups that you'll work in for this literature review assignment. Any questions from the post-bac students?
Last year, was it no more than or no less than 12 slides?
I think it's no more than 12 slides. I forget, actually. So look at the assignment criteria.
Oh, and it's I saw the chiropractic therapy.
Yeah, I have an addition of a person there.
A lot of students have been interested in alternative therapies the past few years. So Jimmy was just asking chiropractic care, is that possible? That's possible if you want to investigate the intersection of that with neuroscience and what's happening. Is it impacting on the brain? So, any other questions? Okay, so find those on Angel, and the assignment is due the last day of class, Thursday, July 7th. Okay. So, as you're probably finding, we're sort of revisiting various areas of the central nervous system. On Monday, we were in the area of the brainstem, but we were focusing on neurovasculature. So today we're going to spend time looking at the surface anatomy, the superficial structures, and then we'll also look at some coronal and some transverse and cross sections of the brainstem, starting to look internally at the nuclei and some of the tracts. So we're going to be starting looking in general. I'm going to give you sort of a general overview or tour, and then we'll start to get a little bit more specific. Roger and I have split up the cranial nerves into 3 lectures. So I'm going to start today with 6 of the cranial nerves, and then Roger's going to continue with that. So as we're looking at cross-sections, it's going to seem overwhelming because there's so many nuclei and we're focusing on some. So we're going to look at a lot of diagrams today, and I'm probably going to have you flip through and mark in your Haynes Atlas so that when you get to lab today, you have some good starting points of what resources to use. So make sure you have your Haynes Atlas out and things ready to mark it up. And I think you started to do some cuts yesterday in lab on a few of the specimens, and so that'll be helpful. I know we don't have a lot of specimens with great intact brain stems, and so that is going to make looking at the cranial nerves this afternoon and next week probably a little more frustrating. The brain stems, what we see this year compared to past years, aren't as great. So we're going to start out with the specimens trying to identify cranial nerves, there's 1 or 2 or 3, I think, specimens that have some nice brain stems. But you're going to have to use your atlases as well to supplement that when those structures aren't there or It's really difficult to differentiate. So, you know already that the brain